This team lives out Matthew 25, that is, using the talents as doctors to reach out to the least of our brethren.
This is the Church on the Frontline with Bishop Allwyn de Silva.
My dear friends, welcome to another episode of Church on the Frontlines. During the pandemic, there was one fear in our hearts. Are we going to get the COVID-19? We were frightened. Health became a priority in our lives. But because of the pandemic, many lost their jobs. Many were orphaned. And so, here's an initiative in the Archdiocese of how doctors came together to reach out to people who were sick, who needed medical help, who needed financial help. My dear friends, if you like this episode, kindly give us your feedback. And we would be happy also if you could donate some money for the people who are in need. Thank you.
Health outreach was born under the leadership of Dr. Milton Fernandes and Bishop Allwyn under the social apostolate arm of the Archdiocese of Mumbai.
Jesus' love for us is incredible, extraordinary. At the health outreach, we have found a way to take this love and give it to the poor through our healthcare services. We have on board with us 30 plus panel doctors. They're specialists who offer free tele-guidance and free consultations at their clinics. They've all been serving with love.
We have a great team with us who have great connections in the healthcare sector, but are bound by one singular goal and mission, and that is to serve. And this team came together with a singular vision of providing affordable healthcare services to the poorest of poor in the Archdiocese of Mumbai and facilitate the healthcare to them.
My journey started during the lockdown, and I most willingly said a big yes. And then I received a couple of mails on how the health outreach program would work.
Health outreach has at its different layers in its structure various coordinators right at the top, right up to parish level coordinators. And these coordinators are our actual hands and feet. They are the ones who identify these needy persons and use the vendors we have provided. So there's a kind of a marriage between the two, and there's a facilitation for these who access affordable healthcare. And all of it is done with a lot of compassion, the same compassion of Jesus Christ.
I, as a volunteer, have to approach the underprivileged and the marginalized of my parish. I went out to all the corners of my parish. I got together a few volunteers to assist me, and the mission began.
The role of the parish volunteer coordinator is one who identifies those who need the help, is one who sets up a desk in the parish, is one who's familiar with the vendors, is one who coordinates with the CICs and keeps reports of all that is happening in the parish.
There was so much to do. Good doctors, experienced people to guide, to focus how to do your best in getting the best for the poor. And as a SVP member, I had the privilege of reaching out to more families than before.
Along with my CIC, I'm able to connect with the best panel of doctors in my city today. And not only that, I'm also able to make it possible for a free tele-guidance. That is something impossible before.
So the health outreach achieves two primary goals. Number one, by issuing an ID card, we are able to identify and filter out the really needy persons. And number two, by them using our network of services, we are able to bring down the cost of healthcare services to almost 1/3 the cost, which reduces the cost burden on the parish community welfare fund.
The next challenge I've always faced is how to get the most affordable medication for the less marginalized. And that, with the health outreach, has become possible. With the doctor's prescription, medication is affordable at discounted rate and even free.
In the last 6 months, working with the poor, we have learned the government schemes and helped the poor use these government schemes for medical assistance. It's been a rewarding journey to help the needy get medical assistance without having to go through financial hardships.
HelpAge India always caters to the senior citizens in helping them with medical checkups and giving free medicines. And we started our first batch of senior citizen medical health checkup in June. And it was a very big success. Out of the 40 listed and the 40 beneficiaries, we had 35 senior citizens. The doctors came, they did the health checkup, they did the blood test, they did the blood pressure check, and they prescribed medicines. And these medicines were given free of cost by HelpAge India. And we are successfully now having this medical checkup every month.
We've been blessed to have with us the HelpAge van, which provides help to the senior citizens poor. Dr. Eye Institute has been instrumental in a number of eye surgeries, and the Health Promotion Trust has given us free medicines for the poor.
During the time of the second phase of the pandemic, the health outreach COVID line was something that helped each one of us in distress, whether it was hospital bed, whether it was plasma donors, whether it was oxygen cylinders, it was just a call away.
Agreed, we cannot cure the world's ailments and diseases and all the sicknesses, COVID-19. But at the health outreach, we have a positive force, a force that drives each one of us, hand-holding every patient registered with us to the gamut of services like blood banks, diagnostic centers, ambulances, dialysis, medicines, and medical equipment. We've given them a spectrum of healthcare services.
What interests me most is the Wax the Poor campaign. We at Dada started off with looking at connecting with the local government center to get a few of our people vaccinated. With coordination and cooperation from our parish priests, cells and associations, volunteers who came forward turned this around into a drive on the 27th of June with people in our area all vaccinated. My greatest achievement is to make this connect between the doctor and the needy patient.
I think one of our key milestones in this project was our collaboration with the Bombay Catholic Sabha, and that's when we were able to catapult our reach of parishes from just a few to many more. We used that collaboration to tie up with so many more parishes, and they in turn were able to reach out to many more needy persons out there.
Faith without action is dead. At the health outreach, our family works with open hearts, with the Spirit guiding us. We've given love and good health to our less fortunate brothers and sisters.
We also have prayer, which is a very integral part of the outreach project. We have prayer warriors who constitute a prayer line team who pray for this project, and we have our monthly rosary where we all meet online. Thankfully, we also have many generous donors.
I'm happy and privileged to be part of the health outreach program.
What I see is our vision of affordable health care to the vulnerable now happening with the health outreach.
The health outreach family has grown to over 100+ members with our prayer warriors, donors, coordinators, doctors, and the dream is to reach out to all the parishes, the over 100+ parishes in the Archdiocese, and to function under one umbrella of healthcare under the Archdiocese. History will remember 2020 as the year of the COVID and a year of despair. But we hope that Health Outreach 2020 will be remembered as that project of hope for the many who needed it in the city of Mumbai.
Come join the church on the front line.
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 This is the Church on the Frontline with Bishop Allwyn Dsouza.